Good afternoon, everyone. Welcome to the National Veterans Technical Assistance Center webinar on using Social Security disability benefits to increase income and housing stability for veterans. My name is Cindy Borden. I'm the Assistant Director of Technical Assistance and Training at NCHV, the National Coalition for Homeless Veterans, and we're one of the partner agencies of NVTech. This afternoon, we are pleased to have with us Jen Elder and Nazara Ware from the Sanford Sword TA Center of Policy Research Associates, Inc., and they're going to be leading the webinar for us. Before I turn it over to them, there's just a few logistical things that I'd like to share with everyone. First of all of the participant phone lines have been muted, and that's so that we don't hear things like music if someone has to put us on hold or typing or those kinds of things that inevitably happen when folks are trying to multitask and do other work. And so for that reason, your phone lines are muted. You won't be able to ask questions by phone, but you will be able to ask them through the on-screen chat box that you see to the right of your screen. If you don't see the chat box, there's a little bubble up there to the right, and if you click on that, that actually gives you the chat box, and then you can actually ask the questions. And when you ask the questions, you want to put the recipient as Q&A group. We will be collecting those questions, and there'll be a couple of times throughout the webinar that we'll then answer those questions for folks towards the middle and then again at the end of the webinar as well. You will also be getting, after the webinar, a survey from me asking just a little bit about your experience and asking you to give us some feedback on the webinar itself. This part I've already gone through, but I just want you to see it again. During the webinar, as I said, you will need to use that chat box to ask questions. You can also email questions to me directly. My email address is on here. It's cborden@nchv.org. So during the webinar, you can either use the chat box or my direct email link, and then you can also ask questions through the survey that comes after the webinar if other things come up later. So with that, I am going to turn the presentation over to Jen and Nazara for them to lead our discussion. Ladies, would you like to start?
Sure, thanks. Hi, everyone. My name is Jen Elder, and I'm excited to join you today to talk about how you can use Social Security disability benefits to increase income and housing stability for our veterans. Helps to end and prevent homelessness. I am the SWORD TA Center lead for our national collaborations with the VA and with Working with Veterans, so we're always so excited to collaborate with NCHV to bring this great information to you. And I'm also excited to be joined today by my colleague, Nazara Ware from the TA Center, and she is our national expert in criminal justice, and she is an expert in working with justice-involved veterans. So she'll be providing some great information in just a little bit. So first slide. So for those of you who haven't had a chance to hear about SWORD, if we can go back one, perfect. The SWORD Technical Assistance Initiative, SWORD stands for SSI, SSDI, Outreach, Access, and Recovery. So SSI and SSDI are the two disability benefit programs from the Social Security Administration. We're not going to get too in-depth today about the criteria for each and what they mean. We'll have plenty of extra information available on our website, which we'll show you at the end of the presentation. We focused on people who are experiencing or at risk for homelessness. So not only do we work with veterans, we work with anybody who would meet this criteria. And SOAR is basically a model for assisting individuals apply for Social Security disability benefits. We know that it is can be a very frustrating and convoluted process, and so it's our job to help make that easier for individuals so we can help them get income, health insurance, and access to housing and employment and all of those wonderful community support. We are sponsored by the Substance Abuse and Mental Health Services Administration, and we've worked in collaboration with Social Security since 2005. Now, SOAR is active in all 50 states. To some degree, some states are just getting started with SOAR, and others are SOAR rock stars, as we like to call them. So as you're listening to this, if you're interested in thinking, oh, I wonder if that's available in my state, our contact information will be at the end, and you can just send us a quick email and let us know, and we'll get you connected with resources local to you. Okay, next slide. So on the next slide, we're pretty proud of our outcomes. We've, since 2005, we've assisted 22,810 individuals experiencing or at risk for homelessness to be approved on the initial application. That's pretty huge. We're really excited about it. It represents a national approval rate of an average of 65% and an average of 94 days in 2014. So that means in 94 days, we can have income and stability to these veterans where, as most of you know, sometimes Social Security decisions can seem to last months and months or years, but that's not so with the SOAR model. The SOAR model can help get those benefits to individuals really quickly, as evidenced by our top 10 SOAR states, which have an average approval rate of 82% on initial application. And some of these areas even have an average days to decision as low as 50 or 60 days. This compares to an approval rate of only about 10 to 15% for individuals experiencing homelessness. So we're raising it up from 10 to 15% up to 65%, and in some states all the way up to 82%. So that's pretty huge. And the result of that is that individuals no longer need to go through this lengthy appeal process if we can get it right the first time. And what saddens me quite a bit is that many people are living on our streets and in our shelters who absolutely are eligible for these benefits, but because missing information, because maybe paperwork hasn't gotten to them, they've been denied repeatedly, and they give up, and they think maybe, I can't get these benefits when they are eligible. Next slide. So what's the need as it relates specifically to veterans? Because that's why we're here today. So I'm sure everybody is familiar with this number. We see it so much, the point-in-time number from January 2014 of almost 50,000 homeless veterans. The reason I bring this up again is just to point out that SOAR can also serve those who are at risk for homelessness or who recently entered permanent housing without income. So we have a more expansive definition. We can serve those who have gone through the Housing First model or are maybe utilizing a HUD-VASH voucher, which that is permanent supported housing, but in SOAR's eyes, they are still could be considered at risk for homelessness, because if you took away that grant funding, if you took away that support and they don't have their own income to support them in housing, for us at SOAR, they're absolutely at risk for homelessness. So we can help even more individuals than the point-in-time count captures. There's been numerous studies as well showing that half of veterans experiencing homelessness have severe mental illness, and over half have other health issues. And so this will be big when we talk a little bit about the definition of disability for Social Security, that these health issues could really mean that these veterans are eligible for these benefits. We're also finding a high prevalence of traumatic brain injury, PTSD, and sexual trauma. And so again, these conditions, if it's impairing their ability to maintain work, they could absolutely help the veteran be eligible for Social Security. Next slide. So why is it specifically important? Income, of course, in itself, income is so important to obtaining and maintaining housing for the path of recovery and employment. So veterans, they can receive disability benefits through Social Security as an alternative to or in conjunction with VA disability benefits. Sometimes there's the rumor that, you can only apply for one or the other, and that's not the case. We want veterans to apply for every benefit to which they may be eligible. So for health insurance, they can also use Medicaid or Medicare that comes with SSI and FSDI. to supplement VA health services. This is also really important for those veterans who don't have access to VHA health care. I'd already mentioned it reduces their future risk of homelessness, particularly important to HVRP grantees is dispelling this myth and showing that veterans can work while applying for Social Security benefits and after receiving them. So when we talk about the definition of disability, you'll see that individuals absolutely can work and earn money, and what Social Security is looking at is, are they able to work to a substantial gainful level? So I'll tell you about what that means in a minute, but we just want to get the message out there that SOAR and employment, and that Social Security and employment absolutely go together, and they can be great complementary programs to help support our veterans. We have a detailed issue brief on this available on our website for SOAR and employment for Social Security beneficiaries. Next slide. For the definition of disability, I just listed a few highlights of the differences between VA disability benefits and Social Security disability benefits. So with Social Security, discharge status is not a factor, and their disabling condition does not need to be related to military service. These two things are huge, because often that can be the reason why a veteran's not eligible for VA benefits. So even if they're denied their VA benefits, they could still be eligible for Social Security, and that's a great path to explore with them. They can access Social Security benefits while they're waiting for their VA benefit decision. We know there can be backlogs in each system, so that's why we say apply for both, apply for anything you could be eligible for, because our ultimate goal is to get them income from whichever source can come up the fastest. And the last key difference is there's no partial disability with Social Security. So where compensation rates with the VA, they are rated on a percentage, 0 to 100%. Social Security doesn't have that. Either you fully meet the definition or you don't. Thanks. Next slide. So what is the definition of disability for Social Security? So broken down to its most basic level, what veterans need to show is that they have a physical or mental health condition which results in functional impairments that limit his or her ability to work at a substantial gainful level, which is quantified as $1,090 a month in 2015. So that is a lot of government speak, so let's break that down a little bit. So physical or mental health condition, or a combination of the two, that's really key for Social Security. It doesn't have to be limited based on one condition. They're going to look at holistically at the illnesses that the individual has. And so are those illnesses resulting in functional impairments? What this means is, does it impact their ability to take care of themselves on a daily basis? Shower, cook, go to the store. Does it impede their ability to function socially? How do they get along with others? Do they have shouting matches at work, or get angry and storm off, or perhaps someone's experiencing depression such that they just don't show up to work, and maybe they get fired because of that. Also, impairments in memory and concentration. That's something we see a lot with traumatic brain injury. So how are these conditions limiting the veteran's ability to work and earn $1,090 per month? So that's basically what this top bullet is showing. So they can work, again, maybe somebody can work in 5 hours a week, and that's fantastic. But if they try to work more than that, their symptoms get to the point where maybe they decompensate and have to go to the hospital. So that 5 hours of work is perfect, and it would definitely be below this $1,090 a month threshold. So we want to celebrate that and let them know that they can still be eligible for Social Security. Now, this second bullet is also crucial. Part of the definition is that the disabling condition has lasted or is expected to last for 12 months or end in death. what this is saying is basically that there's no short-term disability with Social Security. So an example we use a lot is, pregnancy. Maybe someone is pregnant, they're experiencing a difficult pregnancy, so they are unable to work. Maybe they're ordered on bed rest, so they're unable to work for the last 4 months of their pregnancy. So they do have a condition. That condition is clearly limiting their ability to work. However, it's not expected to last for 12 months. Or they could probably go to a nice magazine and sell their story and get lots of money. So they wouldn't be eligible for Social Security because they don't meet that duration requirement. At the end of the day, what we need to show with Social Security is why is the applicant unable to work. And again, it doesn't have to be tied at all to their military service. Next slide. So there are 2 FastTrack programs through Social Security that I definitely want everybody to know about because these programs will expedite the processing of the application once it gets to Social Security. So you still need all the evidence, you still need those medical records and great supporting documentation, but once it gets to Social Security, if veterans meet one of these 2 programs, their cases can be expedited sort of at the fastest level that Social Security processes claims. So this first one, it's a newer program. It was introduced in March of last year, and it's called the 100% Permanent and Total Veterans Initiative. So as I said a few slides ago, you don't have to have a VA decision to apply and be approved for Social Security, but some individuals may have a disability rating from the VA and just didn't know that they could also be eligible for Social Security benefits. So if they've gotten a rating of 100% permanent and total from the VA, they can go through this FastTrack program. They just need to show that VA rating letter to the Social Security Administration when they apply. Now again, it doesn't guarantee approval because they have 2 separate definitions of disability, but at least it helps that process go much, much quicker. The second program has been around for quite some time, so you may have heard about it. It's called the Wounded Warriors Initiative, and it's for veterans who received disabling mental or physical health injuries while on active duty on or after October 1st, 2001. Now, key with this is that it doesn't have to have occurred during combat operations, so it doesn't mean that they had to have received a blast injury in Iraq or Afghanistan. It could happen at home. It doesn't even have to happen in the course of their military duties. They just need to have been on active duty when that occurred. So they could qualify for the Wounded Warriors Initiative and have their processing expedited as well. So those are 2 great programs we want everybody to know about. Next slide. All right. And now I'm going to turn it over to my colleague, Dazra Ware, to provide some fantastic information on justice-involved veterans.
Can you hear me now?
We can hear you now, Daz.
Okay, I was in full swing. This is Dazra Ware. This is the portion of the webinar where I talk about justice-involved veterans, and it's really a great opportunity to really shed some light on the needs of veterans that happen to be justice-involved, particularly because the world is watching and because this is the first time in probably a decade when there's lots of attention given to this opportunity, and agencies and departments of corrections are really looking at what happens to individuals once they return into the community. Next slide, please. So I'd like to just start off by just busting some myths that we all have heard. When I first started this work with SOAR, I didn't even believe that a person that was had an active warrant or that was currently incarcerated or on probation and parole had the opportunity to even apply, let alone have benefits before they were released into the community. And I'd like you to all know that that's all a myth. A person that is justice involved can apply for benefits with active warrants, those that are currently incarcerated, or even on probation or parole. This is really important because with the implementation of SOAR and being able to help individuals apply for benefits before release really increases the likelihood of successful post-release. And we really want to encourage that. So the takeaway from this is that if you are working with individuals that have active warrants, those that are currently incarcerated or even on probation or parole, as long as that probation and parole has nothing to do with the charge of escape, then they are eligible to apply. And if they're currently incarcerated, that becomes really important because we want to establish that that application process and even have it work all the way to a decision prior to someone's release, because they get to walk out with the opportunity to have access to benefits and health care and really contribute to their care and becoming an asset to our communities instead of the liabilities that their incarceration or past history often lets others believe. So it's easier to walk out with access to income and housing and money because it turns the jaded perspective of an individual entering the community that's often seen as a liability. They have access to income, then they have access to housing, and they become paying renters and customers at that point. Next slide, please. So what happens to benefits for justice-involved persons? Well, Social Security Administration pretty much regulates the receipts of disability benefits while the person is incarcerated. And the rules are different for both SSI and SSDI. The next few slides will talk about those differences. Next slide. For SSI, if an individual is incarcerated for a full calendar month, the benefits are suspended. It's really important to understand that it has to be a full calendar month and not the 30 days. So if an individual goes to jail, or say on April 15th, and they are released on May 1st, they haven't been incarcerated for the full month of May or the full month of April, so their benefits should continue. If they're released in less than 12 calendar months, the benefits can be reinstated upon release. And for SSI recipients that are incarcerated for 12 consecutive calendar months, their SSI benefits are terminated and they must reapply. Most of the information will be already housed at the Social Security office, so a person working on an application could kind of find out what Social Security already has and then build off of that information. But typically, it's best to reapply as if the person had never received benefits at all. Reapplication can be made 30 days prior to the expected release date, but benefits cannot begin until the actual release. And the individual must show up at the Social Security office with legitimate paperwork that demonstrates that they have gotten out of incarceration legally, and then their benefits can begin shortly after that. Next slide, please. For SSDI, the recipients are eligible to continue receiving their benefits until they are convicted of a criminal offense and confined to a penal institution for more than 30 continuous days. After that time, their benefits are suspended. So if a person enters incarceration but has had SSDI before they became incarcerated, oftentimes it's not unusual to find individuals that are in jail longer than we expect. I happen to think about a couple of people that I worked with, and one individual was actually incarcerated for almost a year and had never seen a judge, so he had never been convicted. So if that person was eligible for SSDI or had gotten it in the past, his benefits would have continued that entire time that he was incarcerated. Although confined, he had not been convicted. And the important information to understand about this, it have to be convicted and confined for at least 30 days before their benefits are suspended. And benefits are reinstated the month following their release into the community. And again, this is a situation where the individual has to go to the Social Security office with legitimate release papers to demonstrate that they have been released legally. Next slide, please. SOAR is a great opportunity to kind of collaborate with all the efforts surrounding the support for our veterans that happen to be justice involved. There's great opportunities for veterans courts to kind of integrate SOAR into their programs to really assess the needs of the individuals that they serve and really provide access to SOAR providers that can help get those benefits started, oftentimes in lieu of incarceration. Many times incarceration becomes a last resort for systems that don't necessarily know what else to do. So if Social Security benefits can give access to an individual income and housing particularly, then there's a great collaborative effort between those two. Reentry programs are also a great opportunity to integrate SOAR to address the needs of justice-involved veterans. Everybody wants to be able to help with successful post-release and reentry programs, and although there is no kind of direct evidence or data that shows that those folks that are assisted using the SOAR model have greater reentry outcomes. However, we do know that there's tons of evidence that suggests that those individuals that have immediate access to housing oftentimes have the greatest success and are less likely to recidivate. So with the access that the income from benefits can achieve, the access of the income produces more access to housing. And as we know, housing is the key. So, and it's also a great way to kind of get the SOAR efforts out there if participation in stand-down events are available, collaborating with SOAR providers in the communities during those stand-down events to let individuals know that providers are out there and in their community and really willing to assist them. So I really encourage that these opportunities are kind of investigated and finding out how SOAR can be integrated in each of those areas. Next slide, please. So I'll hand it back over to Jen to talk about what's next.
All right. Thanks so much, Daz. So we can go ahead and get to the next slide. So hopefully by now we have piqued your interest in how to use and incorporate SOAR into your work. And so the first step, gather some more information. We have a great issue brief connecting veterans to Social Security benefits. That's available on our website, and I'm sure we can distribute that to anybody on the webinar that wants some follow-up materials. And reach out to us. Ask us questions. That's what we're here for, is to answer any and all questions you have about how to use SOAR, who's doing SOAR in your community, and how to get involved. Another great opportunity that we have is exploring options for SOAR training for your staff. Now, SOAR training, kind of what is it? It's taking trainees through exactly how to file a Social Security application. How do we gather medical evidence? How do we complete Social Security forms? And how do we document all of these functional impairments as a result of the veteran's conditions? Our online course is available at our website. I should highlight that it is free, so that's fantastic. The online training does take about 16 to 20 hours. It comes with free CEUs, 16 free CEUs from NASW upon successful completion. And the reason it's so intense is that as part of the training, it has a full sample practice case. So we provide progress notes, medical records, videos of a fake applicant, and the trainee, as they progress through the course, will fill out all of the Social Security forms, write a functional narrative, and have a lot of support in learning how to file this application. And so once they're done, that their sample application comes to us at the SOAR TA Center, and we provide individualized feedback and guidance on all the things they did really well, on things that they can do to make their application stronger in the future. So this is a lot of intense support, and we're finding that those who go through the SOAR online training are turning right around and filing successful applications for individuals experiencing homelessness in their communities. So it's a great option. If you just want to know a little bit more about SOAR, we encourage you to register for the course and just take class 1. We call it SOAR 101. It has some great videos and basic information, and there's no obligation to complete the course once you've started. Anybody's, welcome to come and register. And then lastly, collaborating with your community partners to refer veterans to local SOAR initiatives. If you're unable to work on Social Security applications in-house, it's great to identify who in the community may be able to help the veterans that you work with. Great. Next slide. And here is just our contact information for any questions and concerns that you may have. Again, our website and our social media contacts. And that is all we have for our section of the presentation.
Thanks so much, Jen and Desiree. I have a couple questions, and I encourage folks, if you have other questions, to send them through the chat line. The first question was asking if SOAR is different from the original BPAO projects and the more current WIPA projects.
I don't know if I'm familiar with those acronyms.
Okay, I will have ask that person to clarify those. Another question, Jen, was if you guys have a list available of current SOAR providers that folks could reach out to.
So we don't have that openly available on our website, but what I should have mentioned, so thank you, question asker, for prompting me to remember this, is on our website there, in the top left corner there is a button called SOAR in your state, and you can click on that, click on your state, and locate a state team lead who's local to that area, as well as a list of local leads and trainers. And so those are the main local contacts in each area, and then they'll have a list of local providers that you can connect to. And it also, there's a SOAR TA Center liaison for each of the states. There's about 4 of us, and so we have a great handle on what's going on in the state, and our names are listed on those state pages as well. So that could be a great first step.
Great, Jen, thanks. So we got some clarification. The BPAO is benefits planning, benefits outreach and planning program, and then WIPA was the work incentive planning and assistance project.
Sure. So those, unless I'm mistaken and thinking of the wrong ones, those are programs from the Social Security Administration. Mm-hmm. And so what we do, we work in collaboration with Social Security Administration, but we are separate. We're a SAMHSA-funded project. And so our roots are in a demonstration project out of Baltimore in around 2003 to 2005. And so that's what SOAR grew out of. So we're separate from them. We provide a lot of great information on benefits planning and work planning, but we're more focused on how to file the application and get that through, and then help individuals once they receive those benefits.
Great, thank you very much. Any other questions from the group for Jen and Desiree? We're going to hold just a second. I have folks who are sending me questions. One question is more of a procedural logistical question about how to get copies of the PowerPoint presentation. This will be uploaded on the NCHV website. The link will come in the survey. It was also in your reminder email about the details of how to call in and be on the webinar today, but that this presentation will go up probably in the next day or two. It sometimes takes a day or two to get it up there, but it will be up on the website at that point. I think that's all the questions we have for today. I'd like to thank Jen and Desiree for giving us this great overview of SOAR and what this model is. Those of you who are HVR grantees, there are a lot of ways that this can be of benefit to your clients to give them that extra income that can help with housing stability and other things in addition to the employment that you're working on. So I encourage you all to go to their website and actually look into the SOAR model and see if that's something that might work for your clients. Jen and Daz, thanks again so much for your help this afternoon.
Oh, you're quite welcome.
Great. Thanks. It was a pleasure.
Thank you all very much. Have a great day. I will be sending out a survey about the webinar, so please look for that in your inbox, but also potentially in your junk mail folder. Because it does come as a group email, so just keep an eye in your spam folder as well. Thank you all very much.